Hello, everyone. My name is Kaylin Washington, and this is my capstone research focusing on the relationship between exposure to violence, victimization, and psychological distress, otherwise called Urban Realities Exploring Exposure to Violence, Victimization, and Mental Health in New York City. This study investigates the association between victimization, exposure to violence, and psychological distress. It aims to understand how experiences of crime and violence impact the mental health and well-being of adults in New York City. The analysis utilized data from the longitudinal poverty tracker study, encompassing a diverse sample of 2,658 adults aged 18 years of age or older in New York City. The results of the linear regression analysis indicated a significant positive correlation between victimization, exposure to violence, and psychological distress, and highlights the impact of traumatic experiences on the mental health of adults in New York City. There has been a growing body of research investigating the complex relationship between victimization, exposure to violence, and health outcomes. Exposure to violence and victimization is an alarming issue due to the potential impacts of health for individuals, families, and communities. A recent study found that a decrease in violent crime at the community level was associated with a greater decrease in cardiovascular and coronary artery disease and mortality rates in Chicago. This finding adds to the growing evidence that violent crime exposure is a potential social determinant of health. And when it comes to adolescence, research has shown that areas of increased community violence can actually lead to higher number of inflammation markers. These kind of markers at a relatively young age could potentially increase the risk of chronic disease in a person's lifetime. By comprehensively understanding this correlation, it's important to understand how we can provide interventions to help mitigate these disparities. As mentioned earlier, this research utilized the Poverty Tracker study to help with its analysis. The Poverty Tracker study is a longitudinal research study aimed at understanding the dynamics of poverty and economic hardship in New York City. It provides valuable insights into the experiences of individuals and families, including their experiences and exposures to various forms of victimization and violence, as well as their mental health outcomes. The data was done by using variable measures for victimization. For example, were you the victim of an assault, theft, or shooting? And exposures, for example, did you witness a robbery, hear gunshots, or witness a physical attack? With pre and post K6 mental health measures. Variables for the mental health measures will be questions asked to participants, including how often they felt depressed, hopeless, worthless, with a scale result of all the time, most of the time, some of the time, a little of the time, or none of the time. Each result is weighted by a point system, with all the time having 4 points and none of the time having 0 points. The greater the points, the greater the psychological distress. Linear regression analysis was conducted to investigate the association between the questions surrounding victimization, exposure to violence, and psychological distress among participants surveyed through the Poverty Tracker. The K6 measure was utilized to assess psychological distress before and after instances of victimization or exposure to violence. The results revealed a significant positive correlation between witnessing a crime in New York City, witnessing a crime in the neighborhood, and being a victim of a crime with greater psychological distress. Results for the findings will be broken down into 3 different sections. The first one will focus on exposure to crime in New York City. The next focus on exposure to crime in neighborhoods. And then after that, I focus on victimization. Table 1A is showing participants who witnessed a crime versus those who have not in New York City. Table 1B is showing the count of witnessed crime in New York City. In Table 1A, witnessing a crime in New York City was found to be significantly associated with higher levels of psychological distress. This indicates that individuals who reported witnessing a crime in New York City had on average a 1.74 increase in their K6 psychological distress score compared to those who did not report witnessing a crime. In Table 1B, participants who reported a higher count of witnessing any crime in New York City exhibited elevated levels of psychological distress compared to those who reported fewer instances of witnessing a crime. indicating that for each additional witness crime, participants experienced on average a 0.88 increase in their K6 psychological distress score. These analyses were then ran against various demographics, including age, wealth, gender, and race, and shows a slight decrease in their overall score, while still also being statistically significant. I then ran further analysis with previous mental health experiences in the last results ran, and witnessing a crime in New York City remained a strong predictor of psychological distress when ran with those demographic factors and previous mental health experiences. The same was true for the count of witnessing any crime in New York City, still statistically significant, even though the results show are much smaller than they were in the very beginning for just running for the initial analysis. I then ran an analysis for individuals who were exposed to crime at the neighborhood level. In Table 2A, for participants who witnessed crime in the neighborhood versus those who have not, and overall in New York City, participants who witnessed a crime in their neighborhood, their score was 1.35. 1.35 indicates that individuals who witness a crime in their neighborhood experience on average a 1.35 increase in their K6 psychological distress score compared to those who did not. When accounting for various demographics, it decreased to 1.06, and when accounting for the pre-K6 mental health measures, it decreases even more to 0.46, still showing that it is statistically significant for witnessing a crime in the neighborhood. The same can be said with the count of witnessing crime in the neighborhood, showing that you are more psychologically distressed when witnessing crime in the neighborhood, accounting for various demographics, and even accounting for various previous K6 mental health measures, still showing a statistically significant indicator that the count of witnessed crime in a neighborhood equates to higher psychological distress. The last analyses ran were those who reported being victims of a crime in New York City. As you can see in Table 3A, participants who were victims of a crime versus those who were not were 2.4 times more likely to be at psychological distress. That number slightly decreased as we accounted for various demographics and as we accounted for various pre-mental health psychological distress factors using the K6 measures, still showing a slight statistic significance in their overall resulting scores. Again, the same thing can be said for the count of victimization in New York City, showing a significant decrease, showing a significant higher chance of being at a psychological distress after experiencing more and different types of victimization in New York City, even though that number does slightly decrease when accounting for various demographics, and even slightly decreasing when accounting for various pre-K6 mental health scores. Overall, it ends up being still statistically significant in terms of showing a correlated relationship. The results from this study are consistent with the findings from other analyses. Studies conducted in various urban settings have consistently shown that individuals who witness or are victims of crime are more likely to report symptoms of anxiety, depression, and overall psychological distress. It's also important to acknowledge and address several limitations when conducting this kind of research. One limitation involves the self-reported nature of the study. And another limitation is the observational nature of the study design, which limits the ability to establish causal relationships. While efforts were made to control for confounding factors, it's also possible that other unmeasured factors may have influenced associations. This study has established a correlation between victimization, witnessing violence, and psychological distress, utilizing K6 measures to assess mental health before and after such incidents. Significant associations were revealed. These findings highlight the negative effects of victimization and exposure to violence on mental well-being, particularly for vulnerable groups. They also emphasize the urgent need for community safety and accessible resources, and while there was room for refinement for this research, it does support studies that have already been conducted regarding the matter.